This is 1.4 notes, regional terms. The essential question is, what are the anterior and posterior regional terms, and what role do they have in studying anatomy? Regional terms are specific names of body areas or locations. They are important to have memorized, so when we start learning the names of muscles, bones, and nerves, it will help you learn those names quicker, knowing these locations. The anterior regional terminology are the ones that are in the front of the body, the ones that you could actually see from the front. The first one is abdominal, which is the lower stomach region or lower abdominal region around the intestine. Acromial is the point or the bony portion of the shoulder. Antecubital is the front of the elbow. Axillary refers to the armpit, and you actually have a axillary artery that runs just along the inside of the armpit. Next is brachial, which refers to the upper arm above the elbow. Again, there is a artery called brachial artery, and you'll know the location of the brachial artery because it'll run along the upper portion of the arm. Buccal refers to the cheek. If you've ever got a DNA test, they'll take a buccal swab, and that refers to the scrapings from the cheek to get a DNA sample. Carpal refers to the wrist. If you ever had a carpal tunnel syndrome, it's kind of a condition where the nerves or the blood vessels that are cut off on the wrist and causes numbness in the hands and fingers. Cervical refers to the neck or the bones that make up the neck. The coxal is the hip bone. Crural is the front of the lower leg. Digital, or sometimes referred to as phalanges, are your fingers and toes. Femoral or femoral is the thigh region. Again, you have a femur, which is the large thigh bone, and then you have a femoral artery that runs along the upper thigh, and you also have a femoral or femoral nerve that runs along down the thigh also. Inguinal refers to the groin. It is the crease between the torso or the trunk where it meets the leg. Nasal refers to the nose. Oral refers to the mouth. And orbital refers to the eye cavity or the eye socket. Patellar refers to the anterior knee. In fact, the bone that makes up the kneecap is called the patella. The pelvic is the portion below the abdominal region. The pubic is the genital area. Sternal is the breastbone, where the ribs come together to meet in the center in the front. And then tarsal refers to the ankle bones, or the bones that make up the ankle. Thoracic refers to the upper chest area. The umbilical refers to the navel or the area around the belly button. So the anterior regional terms, you have the nasal, which refers to the nose. You have the oral, referring to the mouth. You have cervical, referring to the neck. You have the acromial, which is the bony point of the shoulder. Then you have the thoracic, which is the entire upper chest area. Also, the thoracic is the upper portion of the spine is called the thoracic. Brachial refers to the upper arm portion. Antecubital is the front of the elbow. The lower, which we call the forearm, is actually called antebrachial. Umbilical refers to the belly button area. Carpal refers to the wrist bone. Digital refers to the fingers and the toes. The pubic area is where the genitals are. Patellar is the knee region. Crural is the entire lower front leg. And then the tarsal is the ankle region. Fibular is the side or the lateral portion of the lower leg. You have the femoral, which is the entire thigh region. Inguinal is the area that's the crease between the torso and the leg. Coxal is the hip area. Pelvic is the lower abdominal region. Axillary is the armpit area. Sternal is the breastbone in the middle. Buccal is the cheek area. And orbital is the eye socket. The posterior regional terminology are the landmarks that are, or regional terms that are located on the back side of the body. The cephalic really refers to the entire head region. The deltoid is the curved portion or the fleshy portion of the shoulder, whereas the acromial is the bony part of the shoulder. Gluteal refers to the buttocks region. Lumbar is the lower back. The occipital is just to the back of the head, and popliteal refers to the back of the knee. Sacral refers to the small portion of the lower back, a triangular area between the hips. Scapular refers to the shoulder blade area. Sural, which is the back of the leg. Crural is front of the leg, and sural is the back of the lower leg. And then vertebral refers to the entire spine. So again, cephalic refers to the entire head. The occipital is just the back portion of the head. Deltoid is this curved area of the shoulder. Scapular refers to the shoulder blade area. In fact, that shoulder blade bone is called the scapula. The vertebral refers to the entire spine, but the vertebrae is divided into the cervical, which is the neck region, the thoracic, which is the upper chest region, and the lumbar, which is the lower back region. So those are the different portions of the spine or the vertebrae. Lumbar, again, remember, is the lower back. Sacral is this triangle, upside down triangle area between the hips. Gluteal refers to the buttocks region. We see femoral on this one too, because femoral refers to the entire thigh, front and the back. Popliteal refers to the back of the knee. And then sural is the back portion of the lower leg. 1.4 notes homework. Number 1, write a 5-sentence paragraph correctly using 5 regional terms. Pick words that you believe will be the most difficult to learn, and make sure you are using the terminology correctly.